In many Eastern cultures, mental health is frequently interpreted through a complex blend of spiritual, philosophical, and moral frameworks. This multidimensional lens often leads to misinterpretations of disorders like OCD. Rather than being seen as legitimate medical conditions with biological and psychological underpinnings, OCD symptoms are frequently perceived as a reflection of one's spiritual imbalance, moral failure, or lack of self-discipline. For example, intrusive thoughts might be mistaken for demonic influence, spiritual impurity, or signs of bad karma. In some communities, compulsive behaviors may be interpreted as exaggerated piety or devotion, masking their pathological origins. As a result, those suffering from OCD are often encouraged to engage in religious rituals or seek spiritual cleansing before, or instead of, receiving psychological or psychiatric treatment. This can significantly delay diagnosis and lead to a worsening of the condition, as symptoms are treated with spiritual remedies that, although meaningful, do not address the neurobiological or cognitive mechanisms of OCD. The collectivist orientation in Eastern societies places strong emphasis on group harmony, conformity, and social roles, shaping the ways mental health conditions are perceived and managed. In this context, behaviors associated with OCD may be normalized or even encouraged. For instance, meticulousness, orderliness, and repetition can be praised as signs of discipline, respect, or thoroughness, qualities that align well with Confucian, Buddhist, or traditional Hindu values. This normalization can obscure the distress and dysfunction underlying OCD, leading to underrecognition. Moreover, social stigma against mental illness can be overwhelming. Individuals may fear not only personal shame, but also bringing dishonor upon their families. Mental illness is often seen as a sign of poor upbringing, spiritual weakness, or even a hereditary curse, all of which can significantly deter individuals from seeking help. In some families, conversations about mental illness are avoided altogether, creating a culture of silence that perpetuates misunderstanding and suffering. Religion and spirituality are central pillars in many Eastern cultures, providing a framework for meaning, identity, and coping. However, when OCD manifests in the form of scrupulosity, obsessive concerns about morality, sin, or ritual purity, these frameworks can become enmeshed with pathological patterns. In Hindu contexts, compulsions may align with ritual purity laws, leading to excessive bathing or avoidance of perceived contaminants. In Islamic traditions, individuals with OCD might engage in repeated ablutions, wudu, or prayer cycles out of fear of offending God, rather than genuine spiritual connection. Buddhist practices of mindfulness and detachment may paradoxically fuel compulsive attempts to eliminate impure thoughts. While spiritual practices can offer comfort, their intersection with OCD symptoms often reinforces compulsive behaviors and heightens guilt, making it harder for sufferers to distinguish between devotion and disorder. Furthermore, many spiritual leaders may not be trained in mental health and might unintentionally encourage behaviors that exacerbate OCD. Conversely, those who do understand the nature of mental illness can become vital allies in recovery if integrated into a multidisciplinary treatment plan. Access to mental health care in many Eastern countries is often limited by structural, cultural, and educational barriers. Mental health services may be scarce, especially in rural or economically disadvantaged areas. Even where services exist, they may be under-resourced, stigmatized, or culturally disconnected. Language and communication styles pose further complications. Patients may describe their psychological distress through physical symptoms, leading to misdiagnosis or dismissal. For example, individuals with OCD might present with gastrointestinal discomfort, headaches, or fatigue, without disclosing the intrusive thoughts or compulsions behind them. Clinicians unfamiliar with these cultural nuances might overlook the underlying disorder. Additionally, the concept of saving face is deeply embedded in many Eastern cultures, discouraging open discussion about mental struggles. Seeking help is sometimes viewed as an admission of weakness, both for the individual and their family. All of these factors create a formidable barrier to timely, effective diagnosis and treatment. Family plays a dual role in the experience of OCD in Eastern cultures, acting as both a potential support system and a source of pressure. In tightly knit family structures, mental illness is rarely a private matter. Decisions regarding healthcare are often made collectively, influenced by elders or patriarchal figures. A family may prioritize external appearances over individual well-being, especially if a diagnosis threatens the family's social standing. In some cases, family members may pressure the individual to suppress symptoms or conceal their condition from outsiders, including doctors. This can lead to further isolation, internalized stigma, and a reluctance to continue treatment. On the other hand, when families are educated about OCD and encouraged to participate in the recovery process, they can provide essential emotional, logistical, and financial support. Family therapy and culturally sensitive psychoeducation can help bridge the gap between traditional beliefs and modern treatments, empowering both patients and their families to collaborate in healing. Despite enduring stigma, there are signs of progress in how Eastern societies approach OCD and mental health. Increased access to global media, online platforms, and educational resources is gradually changing public attitudes. Young people are more open to discussing their mental health, seeking therapy, and challenging cultural taboos. In some countries, celebrities and influencers have spoken publicly about their struggles with OCD, helping to normalize the condition and reduce stigma. Governments in parts of Asia are beginning to allocate more funding to mental health services, and professional training for clinicians is becoming more robust. Academic institutions and urban workplaces are introducing mental health awareness programs. However, these changes are often concentrated in cities and among educated elites, while rural and traditional communities lag behind. The future of OCD care in Eastern societies will depend on expanding these initiatives, integrating indigenous cultural wisdom, and building trust between traditional and biomedical systems. A holistic, culturally informed approach holds the greatest promise for sustainable progress. Effectively addressing OCD in Eastern cultural contexts requires more than importing Western models of diagnosis and treatment. It demands a nuanced understanding of cultural narratives, family dynamics, spiritual beliefs, and social structures. Mental health professionals must approach their work with cultural humility, recognizing that symptoms do not exist in a vacuum, but are deeply shaped by context. Community leaders, religious figures, educators, and health practitioners must be engaged as allies in promoting awareness and reducing stigma. Psychoeducation campaigns should be tailored to local values, languages, and media channels. Ultimately, healing must honor both the individual's psychological needs and their cultural identity. By weaving together traditional strengths and modern science, we can create inclusive and compassionate mental health systems, where individuals with OCD are no longer trapped in silence, but embraced with understanding and support. As we continue to explore and understand the complexities of OCD through a cultural lens, it is essential to recognize that no one-size-fits-all approach exists. Healing, like culture, is deeply personal. Cultural sensitivity is not about rejecting tradition or imposing modernity. It's about finding a respectful and effective bridge between them. Through listening, learning, and collaboration, we can ensure that those who struggle with OCD receive the understanding, compassion, and care they truly deserve. Disclaimer: this content is for informational and educational purposes only. It is not a substitute for professional diagnosis, treatment, or medical advice. If you or someone you know is struggling with OCD or any mental health issue, please seek help from a licensed mental health professional.